How does hypercalcemia causes constipation? How does hypercalcemia causes constipation? So first of all, there are some facts or some information that you need to know, which is the interactions between vitamin D, PTH, and calcium. Okay, so how does these three interact with each other? So parathyroid hormone functions by breaking down the bones. And when you break down the bone, you release calcium. That calcium will go to the blood. So when parathyroid PTH is increased, there is more calcium in your blood. So hyper PTH will cause hypercalcemia. Second thing is that vitamin D is needed to absorb calcium. Vitamin D is needed to absorb calcium in your GIT. It just facilitates that. So increase in vitamin D will lead to hypercalcemia. That's number 2. So now hypercalcemia, calcium is has a role in the neuromuscular junction, okay, and in all that basics of neuron firing and so on. So an excess of hypercalcium will suppress the neuronal activity at the neuromuscular junction, and this will lead to decreased, smooth muscle contraction and so on, and that will lead to muscle weakness, anorexia, and mostly constipation. So that's how hypercalcemia causes constipation. A scenario would be something like a patient with renal cancer who is having paraneoplastic syndrome, and due to that paraneoplastic syndrome, he has an increase of PTH or any other hormones that are leading to increased calcium. So increased calcium will have constipation. So the patient with paraneoplastic syndrome could have constipation, or any patient with increased calcium will have constipation because of this method, because of this pathophysiology.